Hi, this is Brian Mormers, and I just wanted to go over the clinical schedule for you for pediatric nursing. So, hopefully you've seen this, hopefully you're aware of all this, and you've got it marked in your schedule. But looking at the clinical section for pediatric nursing, you're going to do a wide variety of different things. So, starting off, you're going to have your skills blitz, or OSCEs is what we call those. And on those, that will be done prior to when we actually meet in person. On 8/27. So not fully part of pediatric nursing. It doesn't give you any credit for clinicals, but I just wanted to list that on here just so you have an understanding of that you've got something to do. For some of you, you'll have clinicals right away, or you'll have sim that first week, which is great. You get to jump into peds, you get to learn about it, and then you get to use it, what you learned in simulation for the clinicals. For some of you, you'll have simulation after clinicals. Which is also great because you get the clinicals, you get to work with kids, and then you come in and you get to test your knowledge on how you're going to do in those situations. So both have got their advantages, and so I really hope that you like sim. I've gotten good feedback from it. I think it's going to be a lot of fun for you. But take a look at those times. It is in the sim lab up on the second floor of Jeske. You do need to do prep work for that. That is underneath the resources section. It'll take you a couple hours because we learn about a couple of different things in there. But yeah, have that done, and that will definitely help you out with your sim lab experience. And then talking about the floors and the experiences on the hospital. So at Avera, their pediatric floor is up on the 3rd level. The clinical instructors want you to meet at the lounge over by maternal, up on the 3rd floor, and they will come and grab you then and then take you into the unit. The unit is a locked unit, so just be aware of that one. There is a nursing lounge over at Avera. You've got proximity sensors for that, and so you can get in. Clinical instructors also have got proximity sensors so they can get in as well, and they can show you where that lounge is if you have any questions. But you'll either be in the morning section or the afternoon section. Please be aware that our clinical partners asked for both Avera and for Sanford that we start a little bit earlier. At 2 o'clock they do their rounds in the afternoon, and so they wanted you to be there at 1:30 instead of 2 o'clock so that you could get report from the previous shift and then start. And so I made that reflection here. If that is a hardship for you, please let me know. But moving this up a half hour, and then you get out a half an hour early. But that should really help you out, you and your clinical time, and you should be able to have a better experience with your patients. So that is both for the Avera afternoon and the Sanford afternoon. So other things you get to do, so the Health Connect, we talked about this briefly on the other video, but for the Health Connect fair, this is going to be from 11 until 3 on 9/14. You and some of your classmates are going to present on a topic. You will have a booth. You are going to be running this. You are going to meet with Fran Rice, who is the director of Health Connect, and she will set you up with some great materials on your content. You get to pick your different content with this one. It could be everything from smoking cessation to talking about kidney screen. And so look at those different topic areas. You and your partners will develop content for this to share. Make sure that you have something that grabs the attention of the population. Make sure that you can change your presentation up based on ages and stages. So the way that you're going to talk about this information to a 3-year-old, of course, is going to be different than you talk about it to the parents, and maybe even be different than the way that you talk about it to their grandparents. So be able to have the content, be able to present it in a multitude of different ways, and that is a great skill that you'll have for the rest of your nursing career, is being able to adapt that nursing information. So besides that, we'll have some more clinical experiences. So all of you get 4 clinical experiences on the floor. And so whether that's at Sanford or Avera. Then you have a child abuse conference, and then some of you will have sim. Then we get to go to O'Gorman High School for immunizations, and more information has come on this, but on October 23rd, you get to do immunizations for kids. And so in a way, it's kind of nice because they want to be there and they want to get flu shots. This is ran by the Sioux Falls Department of Health, as well as, of course, O'Gorman. but the kids will come in and you will read them the VIS, which is the vaccine immunization statement, talk about any allergies, talk about any contraindications for this, and then you get to give lots of shots. And so you will feel better about giving shots and immunizations after this. Laura Gertis and Katie White will be the ones that are going to be running this. And so it'll be a fun day. The students in the past have liked this. In fact, that some of you were the students in the past, and so you might have an understanding of what you're walking into with this one. That's kind of it for the Vera groups. So hopefully you have an understanding of what's going on with that. For the Sanford groups, very similar thing. You've got your OSCEs here. You'll have 4 days on the floor. You're going to have Health Connect as well, abuse conference, simulation later on, and the O'Gorman immunizations here. So this is contact information for your clinical instructors and for me. I highly recommend that you put that into your phone and have that contact available if you need to. Weird things happen. People get locked out of the vehicles or things like that. So be able to get a hold of us and let us know if there's any complications. So the red boxes here are going to be when you present on your teaching project. So you'll see that you'll have 3 groups, 3 people going, 3 people going. And so this is the date that you'll present on that. And so for this presentation, your instructor will work with you on this. This is meant to be some aspect of discharge teaching. So if you've got an asthmatic patient, you'll talk about albuterol. This is meant to be 3 to 5 minute little speech. You're meant to have a handout with this. It's meant to be at like a 4th grade reading level. You are all getting very proficient within nursing and within healthcare, and you're utilizing terms without knowing it. I want you to back it down. I want you to be able to talk to kids about what they are on, why they're on, what things they need to watch for. So if they're an asthmatic and you're giving them albuterol, you can give them teaching on albuterol. But I don't want you to be like, yes, it is a short-acting beta-2 agonist that can cause tachycardia, and this is supposed to relieve hypoventilation, blah, 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 and using these big terms that they don't understand. What do they need to know before they go home with this medication? How do they administer it? What are the things that they need to watch for, and put it at a level that they can understand? So before you start practice, it's great to have some discharge teaching practice. So that's why we're doing it. So, but yeah, so you can kind of see these things. With this, with all clinicals, when you're on the floor and at these different experiences, you might not like it. I want you to fake it until you make it. Multiple reasons for this. I want this to be, when you're there, act like this is the best experience ever. Really focusing on your patients, really focusing on helping those around you, whether you're the nurses or be actively engaged at the healthcare or be actively engaged at the abuse conference, because it'll make it more fun for you. If the nurses and people see that you're engaged and that you're working with this, they will take you and they will show you the cool things. If you are just got your head buried working on paperwork, don't really care that you're there, not liking it, not having fun, people are not going to bother you. They're like, oh, they don't want to be here anyway, so why take the time? But if you show some interest with it, ask good questions, be engaged, get call lights. I can't stress that enough, because number one, it frees up the nurses to do the charting so they can do the stuff they have to do, so then they can show you the cool things that they want to show you. And then also, if you might be the first responder then in those situations of, oh, you know, my IV pulled out, what do I do? This happened, what do I do? And it gives you great experience in those rooms like that. And so you might not know how to answer every situation. You can walk in, you can silence it, you can grab the nurse, you can shout for help. You are very capable and competent and can do that without a doubt. So you really help the people out on the floor by grabbing call lights, being actively engaged in your learning experience, and it will make it so much more fun for you. We realize that there's a wide variety of backgrounds coming into this. I know some people work on a pediatric unit, and I know some people have never changed a diaper before, never babysat, have never had siblings. So we will tailor your experience basically where you're at, and you're going to be able to grow and develop as a person and as a nurse throughout this course. So I think that describes clinicals fairly well. I'm excited to have you participate in these, and if you have any questions, please contact me.